Good morning, guys. Tony Maritato here, licensed physical therapist, and in today's video I want to talk about 10 things to prepare yourself for your upcoming rotator cuff repair surgery or any other shoulder surgery you might be scheduling. So number one, which is kind of a weird one to talk about, but number one is prepare your shower. Your bathing, your shower. If you're somebody who takes showers on a regular basis, one great option is to get one of those detachable shower heads with the hose so that you can get it down with your non-surgical arm. You can kind of wash underneath the arm, you can wash around the body, you can keep yourself clean and bathed. Nothing feels better than taking a nice hot shower after you come home from surgery. Just be aware that you have to keep the dressing and the sutures clean and relatively dry. So number two, you want to get prepared with some assistance around the house. There's going to be a lot of stuff you can't do, especially if it's your dominant hand. So whether you're scheduling friends or family to come over, whether you're preparing meals ahead of time and having them microwave ready, whatever you need to do, just plan on at least 2 weeks of being virtually incapable of doing anything for yourself, and then having the help available that you're going to need throughout the day. So number three, decide how you're going to sleep, where you're going to sleep. I can tell you right now, most of the patients that I work with following rotator cuff repair, total joint replacement, labral repair, subacromial decompression, they're usually sleeping in a recliner for the first couple days. Some of them don't have a recliner, they're sleeping on the couch. If you look on this channel, you'll find videos of me talking about how to position yourself in bed, how to position yourself on a regular standard couch, or using a recliner. But just have a sense of where you're gonna be with a couple different options in case you get there and you realize it's not as comfortable as you hoped that it would be. You wanna be aware, number four, be aware of complications. You wanna keep an eye on your incisions. You wanna look for excessive seepage or drainage, excessive bleeding. You wanna pay attention to the skin, the texture. Is it getting more and more red? Is it getting tight and swollen? I always recommend that my patients use their cell phone and snap a picture of their shoulder on a daily basis so that you have a record, a progression of what's changing. Because sometimes, some skin irritation and some redness might be so subtle you don't realize it until it's been progressing for 2 or 3 days. So do what you need to do, but monitor the incision and make sure you keep an eye out for complications. Another common complication is swelling in the hand and the fingers. I've got another video on this channel talking about that, but when the arm is down in a dependent position for an excessive period of time, I have seen patients that come in with just lots and lots of fluid just sitting in the hand. So there are some things that you can do to reverse the negative effect of that. Of course, number five, you want to prepare for physical therapy. You want to understand when you should be taking your pain medication, but even before your surgery, if you can have a pre-surgical consult with your physical therapist, it would be a great time for you to learn some of the basic exercises that you're going to be doing after surgery so that you're able to better understand what to do rather than waiting till you're in pain, you're groggy, you're uncomfortable, maybe nauseous, and then you need to learn new exercises. If you can get in there before surgery, learn the pendulums, learn 2 or 3 things that you're going to be doing, I think it'll save you a lot of frustration. Of course, take care of the dressing. I already mentioned it. We want to keep it clean. We want to keep it free of debris. We want to keep an eye on it so that if you are bleeding or draining, you're going to change that dressing as frequently as you need to. Most physicians and surgeons now have some sort of electronic communication where if you think that something looks wrong, you can snap a picture and send it over through MyChart or something like that. Also, most therapists will have that functionality. I know that patients send me pictures of their incisions all the time. So be sure that you have somebody who can be a second set of eyes for you. Number 7, if you're going to use heat or you're going to use ice, just have it ready ahead of time. There's lots of options with this. Some people do best with moist heat. Some people do best with cryotherapy. You can have a recirculating machine that pumps cold water through a pad that sits on your shoulder. You can have a regular gel pack. I love the Chattanooga cool pack. They stay cold and they stay soft. But whatever you use, just have something available, test it out, use it before surgery, get to know what it's going to feel like so that after surgery, it's just automatic. It's second nature. Number 8, you want to think about your clothing. They do actually sell specific t-shirts designed for people who are having rotator cuff repair. Most of my patients will wear a regular t-shirt like this. They'll cut the sleeves so that it opens up and gives access to the shoulder. You're basically looking to have something that either you can just drape over your shoulders or very easily get in and out of, loose-fitting clothing, cotton, something that breathes, something that allows air and circulation. It's not unusual that after a shoulder surgery, you're going to be experiencing frequent trips to the bathroom, frequent urination because of the IV, but you're also going to experience kind of temperature regulation issues. Sometimes you'll break out into a sweat, sometimes you'll feel cold. Just have some extra layers of clothing available that are easy to take on and off. Number 9, of course, is pain medication. Talk to your surgical team, follow their direction. Pain medication has its role in your recovery. You want to find a pain medication plan that works best for you. There is no one size fits all. Your plan will be unique to you. And then number 10, the most important of all of these, be patient. Not just be a patient, but actually be patient. Be a patient. Give yourself some leeway. Imagine it was somebody that you cared about who had the surgery that you had. Think of what you would say to them. Think of how you would treat them and afford yourself that same kind of luxury. Because usually what I see is when the surgery happens to somebody else, people are far more compassionate than when the surgery is happening to them. So give yourself time, give yourself rest, sleep if you can. When you can sleep, take advantage of it because sleeping is going to go a long way in helping the recovery. And just use this experience not just to help your shoulder recover, but to really kind of make it a turning point for you. You know, this is a great opportunity for you to start making some changes, to get into some new routines. Maybe you can read some books that you've been wanting to read that you haven't gotten to. Maybe you can call some friends or family that you haven't had a chance to touch base with, but you know that you miss them in your life. I can tell you that the more support people have around them, the more time they spend doing the things that they love that make them feel fulfilled, the better the outcome is for those patients. So guys, I hope these 10 little tips and tricks gave you some useful information. If you want to learn more about your upcoming shoulder surgery, go to my channel, look around. You can click on this thumbnail right here. This is what YouTube is recommending you watch next. And if you haven't already subscribed, please help me grow this channel. This is a brand new channel for me. I want to cross that 1,000 subscriber mark as soon as possible. So I appreciate your time and support. I'll catch you on the next video.